Well, good afternoon and welcome to Virtual Face-to-Face with President Bruce Jarrell. I'm Alex Lakowski, Executive Director of Media Relations. Almost 9 months ago to the day after the World Health Organization declared COVID-19 a pandemic, Long Island ICU nurse Sandra Lindsay became the first American to be vaccinated against SARS-CoV-2. I feel great, she told CNN's Anderson Cooper right afterward. My profession is deeply rooted in science and I trust science. Now, that was December 14th. And the Pfizer vaccine had just received emergency use authorization from the FDA. A few days later, of course, a second vaccine, Moderna's, received EUA, prompting Operation Warp Speed's top scientists to predict that 20 million Americans would be vaccinated by the end of the year. That's the same sort of optimism contained in a White House statement in September that said any American who wanted a vaccine probably would be able to get one by April. Well, as of today, January 14th, 30.6 million doses have been delivered to the 50 states, but only about a third of that number, 11.1 million Americans, have received the first of their 2 doses. The latest numbers on Maryland's COVID-19 vaccination dashboard shows that 178,000 Marylanders have received a first dose. That's a hair under 3% of the state's population. The national average is just a little bit over 3%. So why are things moving slower than many of us expected? Well, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, said one factor is that guidance from the Centers for Disease Control and Prevention has been a little too rigid. Those are his words. He suggested loosening distribution rules a bit, not changing priorities, but a focus on what he called getting it into people's arms. Well, here in Maryland, the pace of vaccination is starting to quicken. Last Friday, Governor Hogan noted that 15,000 doses had been administered in just the previous 24 hours. And he dismissed ideas that would radically accelerate distribution. Such moves would rely on there being enough vaccine doses shipped in the future to meet the demand for those required second doses 3 and 4 weeks after the first. I don't want to have vaccines laying around, he said. I also don't want to run out and not get to second doses. 2 days ago, mindful of public criticism, a pandemic that's raging more than ever, and a new and more easily transmissible strain of the virus, the CDC changed its vaccine distribution guidance, lowering the age of older Americans in that priority 1A group that we're in from 75 to 65, and including adults of any age with certain comorbidities. Now, Governor Hogan has scheduled a 5 p.m. press conference this afternoon, and he's expected to address that. So there is a lot happening right now. Of course, none of this answers the questions that are on everyone's mind, like, when will I be able to get the vaccine? And can something developed so fast really be safe? Can we plan for things like travel and commencement? And when will enough people be vaccinated so we can finally ditch the mask and get back to normal, or whatever normal is going to look like? Unfortunately, we have the very best people in Maryland to answer those questions that and any others that you might have. We're hoping we get Lieutenant Governor Boyd Rutherford. He's been an integral part of every aspect of Maryland's pandemic response, particularly in efforts to maintain the state's day-to-day functioning and providing economic support for residents and small businesses. Dr. David Marcozzi is Governor Hogan's chief COVID-19 medical advisor. He served on the governor's coronavirus task force from the beginning. And of course, we at UMB know him as the COVID-19 incident commander for the UMMS-UMB Unified Command. He's also a professor in the School of Medicine's Department of Emergency Medicine. And Dr. Wilbur Chen is back with us again. Like Dr. Marcozzi, Dr. Chen is a member of the governor's coronavirus task force. He's a professor of medicine in the School of Medicine, an infectious disease expert, and chief of the Adult Clinical Studies section in the Center for Vaccine Development and Global Health. Welcome to you all. I want to be sure to let everyone know that this program is being recorded and will be posted on the UMB homepage, umaryland.edu. I'm sure the audience is champing at the bit with questions today. A little later in the program, you'll have a chance to ask those questions. Please look for the chat button at the bottom of your screen. Select chat with host and write your question there. When the time comes for your question, I'll open your mic for you, so all you have to do is speak up. Now let me introduce your host, UMB President, Dr. Bruce Jarrell.
Thank you, Alex, and thank you all for attending this session with us. We hope to have the Lieutenant Governor with us. He's been with us actually since before 3, but we can't quite get his hearing part worked out on his computer. So it's hard to participate if you can't hear the question. So if we get him this time, that'd be wonderful. If not, then we'll try to figure out another time, because we certainly want to interact with him and hear from him. But what we'll do is go ahead and get started. And if at some time he's able to tune in, we'll be that much more advantaged. So thank you, Dr. Marcozzi and Dr. Chen, for being here. I know you've been very generous with your time, which I know is very short. So why don't we get down to brass tacks here, just reminding the audience that we'll get to your questions very shortly. So please send them to Alex. Dr. Marcozzi, you've been on the front line of a lot of things, but you're also on the front line of getting these vaccinations done in people's arms. Where do we stand on that from the UMB, UMMC point of view? How well are we doing, and what do you think? What do you think our report card has been for vaccinations?
Dr. Jarrell, thanks very much. It's an honor to be with you and obviously this group today. Always good to see you, Dr. Chen, and hopefully the Lieutenant Governor is able to join us. So we have had, let me first start by saying that I have had my vaccine in what I'm going to describe now as a true success story for both UMB and the University of Maryland Medical Center coming together and in joint fashion working towards establishing a process and a location that assures we have the ability to vaccinate not only the medical center or the UMB campus, but for potentially much larger as we expand out into different populations. But I'll let you know my experience. I went to the SMC the other day with Dr. Sunta, had a vaccine actually in my right deltoid. It was administered by Dr. Lisa Rowan, and I was a little bit sore for a few days. The process took about 15 minutes in total. And I was then, after I registered, had my shot, verification of the shot, got my vaccination card, immunization card. I then went to a 15-minute observation period to assure that there were no side effects that were untoward, and I had no side effects. I then left without any issue. In candor, I'll let you know that I did feel a little bit of right arm pain, just like we would any other flu shot, about 8 to 10 hours later. The next day, it hurt me a little bit, felt like I was punched in my arm. About 48 hours later, I had no symptoms at all and went about my normal day without any issue at all. Took no medications for it, had no fever, had no myalgias. So that was my experience at SMC. The ability for that location to not only vaccinate our community, number one, and number two, do it safely and effectively in coordination with healthcare providers, our UMB campus, in a fashion that allows for a successful mechanism and process to not only administer it, but communicate effectively on when and how we should be getting that vaccine is important. Certainly right now, but as we march forward into our other communities and expand out to our over 75 or over 65, our firefighters and everyone else who's interested in getting this vaccine, the SMC will be one of those success stories we talk about that can vaccinate many more people in the future. I hope that helps answer your question, Dr. Jarrell.
I think so. Lieutenant Governor Rutherford, it's a pleasure to have you here, and I hear you can hear us now.
I can hear you now and see you.
Excellent. We're so glad to have you here. It's a great honor to have you on our face-to-face show and to hear directly from you of how you think we're doing as well. I remember reading that one of your areas of great interest was that you were a guru in how to operate a government. That was something that you like. Now, I'm sure you like more than that, yeah. But you like that. And I guess when you came in as Lieutenant Governor, you didn't know quite that it was going to mean what it's meant lately, huh? In terms of the COVID thing. But tell us, how do you think the state has been operating? I mean, outside the COVID world, in terms of, as you said, keeping the trains running. Are we doing a good job? Are we keeping up with things? All of those kinds of questions.
Yeah, well, COVID has really changed a lot of what we do. So even just general operations have been affected by COVID. I mean, when you look at, the impact on our unemployment system, just in a month's time, we had more people filing for unemployment than we did in the prior year, complete year. So it overwhelmed the system. We had to rebuild it completely. So just from a standard operations have been affected greatly. I feel we're doing well. A lot of our workers who can work remotely are working remotely and have been able to do that quite well. So we are still, keeping the wheels of government continuing to operate through all this time, but it definitely has had an effect and it's changed the way we have to do business.
Do you think about operating the government differently now compared to 2 years ago? What's changed in your mindset about how to run this place?
Well, it's really given us, I think, an opportunity to look at efficiencies in greater detail. Some of the things that we're doing to respond to COVID, and we'll probably talk a little bit about that on the healthcare side, are things that we said we should continue to do this. It's allowing us to operate much more efficiently. Some of the property landlords may not like it, but when we're looking at our space and how much space we have with people who are either telecommuting full-time or hybrid in a sense where they're spending some time in an office and some time in their home office, thinking about in terms of how much space and how to the space that we do have, how we lay that out. So it's making us think a lot more about how we can deliver goods and services efficiently to the citizens of Maryland.
Yeah, we've had that same observation at UMB. We have over 5,000 people teleworking. And quite frankly, I think our operations are at least as smooth as they used to be, maybe even a little better at times. So
in some cases, yes.
So that's been a good thing. Alex tells me we got a lot of questions, so I'm going to get to Dr. Chen here first because I want Wilbur to address two things for us. Tell us a little bit about these variants of the COVID virus, but also then tell us what you think we're going to be planning for in the spring. Should we have graduation? Should you have your wedding if you were planning one? Well, what's sort of your forecast for the next 6 months?
Well, let's tackle that first question about these variant viruses that we're hearing about in the popular press now. And these viruses that we're seeing evolve, catching right now are probably a biological inevitability. We see this with influenza from year to year, and that's why we have to update the vaccine from year to year. And sometimes there are major changes, sometimes minor changes. Again, that's something that we do traditionally for influenza. So I think that, again, it shouldn't catch us off guard necessarily, but we do need to have a national program for continuing to look at these viruses. We need to have a global program to also look for these viruses because we may not find them initially come out of the US, as in this case, we're seeing one that evolved out of the UK, another one out of South Africa, and another one that we're watching out of Brazil. But there are probably more. There will continue to be more over time, and we just need to be smart as scientists to look globally for these viruses. So that's one thing. So these viruses, why are they so important? They have mutations in that spike protein, which is such an important part of that virus that helps it to interact and to infect the human. And if there are more mutations that allow it to become more transmissible, which is what some of these viruses are demonstrating, that they are more transmissible, then that means more humans will be infected. The good news is that it's not resulting right now in more severe disease. So that is at least something that is a bit of a relief to us medical and in the scientific community, because we're not seeing more risk of hospitalization or death with these viruses. But there is the potential with more mutations that they may be able to mutate so that our therapeutics and the vaccines that we're just starting to deploy now may not be as effective. Now, I don't think that any of these viruses have demonstrated that the vaccines that we have are ineffective. But over time, if we have more and more mutations, that is really the risk. And that's why we watch these very closely. So let's go to that second question about, what is my forecast? What does the crystal ball say for the spring? And so, I think that right now it's winter and we're getting into, we'll eventually get into an early spring. It will continue to be cool, and that's the climate where these viruses like to replicate. This is just like we saw back in the other spring wave when, early on in March, April. So I don't expect that we'll be out of the woods by March, April, especially because we're having difficulty employing these vaccines to the entire population within short amount of time. It's more realistic that we in the state of Maryland and all across the US will be able to more fully deploy these vaccines by late spring and early summer, so that hopefully, this is my aspirational goal, by late summer and before we enter into the fall and the new semester for K through 12 in colleges, is that the majority of the population will be successfully vaccinated. And that is what I'm trying to kind of prepare for, that eventuality to be able to fully open up by that time in the fall. I think it's hard for me to really broadcast that or forecast that that for this spring we'll be opening up again, because we probably won't have enough vaccines in enough of the population. That's kind of my crystal ball. I'm also going to, because Dr. Marcozzi also shared about his vaccine experience, I'm going to share as well my vaccine experience, and I printed up this placard to really kind of emphasize the reasons why it's so important for each and every one of us to be vaccinated. It's a personal decision that protects your family. It helps me as a physician to take care of more patients. It helps to provide that community immunity that I just talked about. And I think all of us here today are listening because we want to open up Maryland. So I think that those are really the major reasons why we want to make sure that we get these vaccines out there.
I think you've just given the Lieutenant Governor a new slogan.
Yeah, I like that, Dr. Chen. I like that.
Now, Alex tells me we're awash with questions. So rather than do any standard questions here, I think hearing from the audience would be a very good thing. So Alex, why don't you start on that?
All right, let's not waste any time. Amy Ramirez is here with a question. Amy, go ahead.
Hi, thank you, everybody. So my question for the speakers is to discuss any plans to vaccinate children, because I understand that the clinical trials thus far have not included children.
Dr. Chen, any ideas on that?
Yeah, and that's a great question. I've heard it many, many times, and I think it's a source of consternation, even just within my family. I've got two kids that are, middle schoolers. They, I'm very interested in having them get vaccinated. So the bottom line is that we haven't done the clinical studies to prove the efficacy of these vaccines in children. Now, there's no scientific reason that they won't be efficacious, but there is the possibility, because they're smaller in size, that many pediatric vaccines are actually a smaller size than the adult vaccines. So some of them are a half dose or a quarter dose of what the adult vaccines are. So I think that that's what the studies are trying to do, is trying to optimize the dose for kids, for especially young kids, because we don't know, we already know, as Dr. Marcozzi just mentioned, that it is a little bit reactogenic. You get a sore arm. It's not the end of the world, but again, to a smaller child, if they get a dose that's an adult dose, maybe it'll be enough that a parent will be hesitant to get their child, or the child themselves will really, balk at getting vaccinated because it is painful for that short period of time. So again, why would we want to have that be a hurdle or an obstacle to vaccination and full uptake? So we would like to do those studies quickly to be able to inform the policy behind vaccinating children. So these vaccines will be effective. It's just trying to figure out what's the dose. So I think that that's really what we're trying to answer right now. Those studies are being done very quickly in the background.
Thank you. And Lieutenant Governor and Dr. Marcozzi, if you have anything to add, just blurt it in.
Okay.
Since we're talking about
one thing on, didn't one of the studies include those up to age 12? Is that correct?
One of the studies right now that's being done is in adolescents. Yes.
Yes.
It's a 12 to 18-year-old study. So I think that the data is being, generated right now. We want to eventually go down to much younger children, because I think, again, a target audience that's very important for many of the audience members is the preschoolers and the K through 12. So it's not just, the middle schoolers on up. Actually, the parents that are at home struggling with education and their jobs are the really young kids. My middle schoolers can take care of themselves for most of the day, so I'm actually not worried about them. It's that population of really young kids, and that's where we need to go with these vaccines as well. Yep.
Well, Dr. Chen, also, wasn't there information that the younger children are less likely to get the COVID virus as well as transfer it? Weren't there some early studies that said they were less likely, unlike the seasonal flu?
Yeah, so the data right now looks like that younger children and children in general, when you compare them to young adults or older adults, have much less risk for severe disease. They have much more asymptomatic infection and mild infection. There is some data that suggests that young children actually can be a high source of transmission, yet still be asymptomatic. So I think that the younger children population are still important for us to tackle the entire pandemic effort, because until we can really completely halt transmission in our populations and communities, we really won't get out of this pandemic. So that's why the pediatric population, even though they're not an important part of the illness, of the drivers for hospitalizations to our medical systems and for the deaths, you're right. That's not a big driver. The kids are not, but they are still important for transmitting in the population. And so that's why it's such a key part of that formula for defeating the pandemic.
I don't want to monopolize the time with my elementary questions, but in inoculating children, could you eventually see us get to the point like with polio? Some of us are old enough to remember when we got polio vaccines in elementary school. Yeah, here too. We used to get a sugar cube, that had a little vaccine in it. That helps to kind of get rid of polio in a lifetime. Is that possible? Do you think that these children can develop an immunity?
I think that's, again, the underlying approach is that we want to vaccinate the children. Now, we won't probably have an oral sugar cube based vaccine this year. And if we had the luxury of time, because I think, the March of Dimes, which is what kind of was able to overcome polio in that era,
right?
So important, was it took about 4 or 5 years. So we don't have that amount of time. Right, we want to work faster. But I think you're right. Our approach is that we want to be holistic in tackling the entire population, and young children are an important part of that component.
One other thing I'll just mention, Wilbur, correct me if I'm wrong there, Pfizer had 16 and above, right?
Yes. Pfizer did have 16 and above. So yes, they had, Moderna was 18 and above, so 2 years younger. I think it is an important part of knowing the differences between those two vaccines. That's right.
So the Lieutenant Governor, you'll remember that vaccine transformed things, because you couldn't go out and be safe. You couldn't go to swimming pools. You couldn't go to congregate areas. And that vaccine, and both of them, the Salk and the Sabin, came along, and it really opened things back up very dramatically. So it was a wonderful example of how this really works. Alex?
Okay, so I wish I could express to you how many questions. It's great that people are so interested that we have. It's an amazing thing. I hope, and keep doing it. So there are a lot of questions that are on sort of the fringes. You mentioned children who were not part of either of the study groups, at least below 16. There are questions about whether pregnant women who are also not included. And I'm going to bring in Dennis Frederick, who is in a group that was talked about people who have comorbidities, and he's not in the 75 and above. Well, he can tell you his story. Dennis, are you there?
Yes, can you hear me?
Yes, go ahead.
Well, I'm a 74-year-old male, and I'm in pretty good shape. I'm not overweight, don't have diabetes or anything like that. But in 2009, I had open heart surgery. So I'm a little confused as to whether that's considered to have comorbidity or not.
If you had heart surgery, then that means you have an underlying cardiac condition that makes you eligible for that comorbidity, and so you would be prioritized. Dr. Marcozzi?
Spot on, Dr. Chen.
Okay. Alex?
All right, I'm going to bring in Meredith Upton. Meredith, I did not give you a heads up that I was going to come to you. So hopefully me telling you that I'm going to come to you will give you just a minute. A question probably on the minds of a lot of people in our community, our UMB community. Oops, I just unmuted the wrong person. I hate when I do that. Meredith, are you there?
I am here.
Go ahead.
Okay, so this is great that I have the Lieutenant Governor and Dr. Jarrell on the line, and I hope I'm not putting you on the spot here, but
Well, you're supposed to put them on the spot. It's on the spot time. Go ahead.
okay. So given the war that we've been raging against COVID-19, and all of our frontline healthcare workers have been battling in the trenches. They're getting the virus. They're facing fatigue every day, and then they're dying. And so this big question that I have as a fundraiser for the university is, has the state of Maryland and UMB considered forgiving student loan debt that our healthcare workers have incurred? So something like a retroactive GI Bill, or doing partnerships with companies. I'm always thinking lots of different ways of how we could do that, but I just kind of feel so strongly that we're going to come out of this and people are going to have student loan debt, and they're just going to say, after all of this work I've done, how do I still have this much money that I have to pay back?
Great suggestion, Meredith. Lieutenant Governor?
Yeah, I mean, there's been discussions about really more on the side of incentivizing people to go into the healthcare industries, and in terms of either scholarships or some type of debt assistance of some sort. It's something to look at in terms of student loan debt. Everyone can, and no question, our healthcare community has been working feverishly to keep us all alive and to deal with the surge of people that came in. But you do understand that, if you forgive the debt of one group, there's going to be another group that's going to come in. And I'm not going to say who's more important than anybody else, but that's the reality of what we will be facing with that whole question. But there have been a lot of discussions about how do we increase the workforce in the areas of public health, be it physicians to the nursing staff, the paramedical facilities, and particularly in the areas of behavioral health. There's a shortage of psychiatrists and psychologists, so it's how can we increase that workforce and keep people in it.
Yeah, and related to that, at the governor and your request, we have been graduating our students out of cycle so that they get into the workforce quicker. They still fulfill all the requirements, but we've had well over 100 people just here at UMB in nursing get released early. So that's been a good thing as well. I don't know the exact number. Maybe Dean Kirschling will call it in, but it's been a lot of nursing students. So thank you for that question, Meredith. Alex?
All right, Anya O'Neill has a question about essential employees. Anya?
Hi, can you hear me?
Yes, go ahead.
Great. So I'm a student on campus. I'm a graduate student. I work in a research lab. And many of the researchers on campus, including staff, postdocs, and graduate students, have been working in person since the beginning of the pandemic. And we were considered essential then, but we've heard very little about when we will expect to get vaccinated. So my question is, are researchers considered essential workers, and when can we expect to get vaccinated?
In terms of the priorities that were laid out by the CDC and that the state has adopted, the governor will be announcing some additional, moving to additional phases in about an hour, a little less than an hour.
Yeah.
And so you'll hear more, but as we move to phase 1B and some announcements with regard to phase 1C, researchers are included, I believe, in the phase 1C, but it could be in phase 1B. But it will be in the next couple of weeks. Now, let me just go back. The issue that we all have is the amount of vaccines that are available. If we had a 100% supply for any Marylander that wanted it, we wouldn't be going through this prioritization process. And the first was to address those who were most at risk and the people that were most who were dying in the nursing homes. Over 50% of our fatalities are nursing home related. But also the frontline healthcare workers. And so as Dr. Marcozzi talked about and Dr. Chen talked about, the healthcare workers are still, the hospitals are still going through their healthcare staff. There's going to be some discussion about the fact that if there is resistance, which we've been hearing and from different organizations, that there are individuals in the facilities, both at the hospitals as well as nursing homes, that are saying, I don't really want the vaccine right now, I'll take it later. But we're going to be encouraging the hospitals to say, okay, tell them it's going to be later, and we don't know when that's going to be, but we're going to move to the next category. And that may be someone else that's in the hospital, someone else that's in, the researchers, someone else that's, in healthcare. We have opened it up to all licensed healthcare providers, and we'll be going to the 75 and above, and pretty soon to 65 and above.
And Marco, I think you would say we have been adhering very closely to the state guidelines.
Yeah, no question about it. We're looking forward to the governor's announcement later today, but we're sticking through with what UMB's and UMMS's approaches and staying in line with our state.
So we'll get to you, we hope, soon. Alex?
All right. So I'm sorry that Karen Myers dropped off. Maybe she had. Oh, wait, she appears to be here. I'm going to try to bring her in. Karen, I'm going to bring you in. She's a UMB employee, and she has a complicated story. Go ahead, Karen.
Can you hear me?
Yes, but yes, I can hear you.
Why is it?
I think you have two devices open, Karen.
Oh.
Karen? Karen, are you there?
Okay.
Go ahead.
You can hear me?
Yes. Well, get that echo back. Turn your volume down on your computer so we can hear you clearly.
Okay.
Now try it. Well, Karen, I'm going to have to read your question for you, unfortunately. She says she's a UMB employee and has registered for the vaccine. I'm waiting for my turn, but I'm among the healthy population. My husband has ALS with significantly compromised respiratory function. He's only 50. Will individuals with health issues receive priority over the general public? And if so, and when will they be able to receive it? We've received no information from his clinic at Hopkins, and he is on home hospice, which they told us they do not inoculate.
Yes, he would be in the 1C category. The CDC recently is suggesting 65 and below and comorbidities. They don't have to be 65 plus the comorbidity, but anyone who has a comorbidity. So it's starting to open up, and he will be in one of the next priority groups.
Marco or Wilbur, anything to add there?
That is correct. Lieutenant Governor said it correctly, that we are trying to prioritize people according to their risk factors for severe disease, and what you described was one of the ones that we have identified. So stay tuned, because again, it's all according to kind of the ability for us to have adequate supplies of vaccine, as Lieutenant Governor Rutherford said. So if we had 100% vaccine available, we would be able to open up more fully, but you have to go through this phased kind of prioritization scheme, and we're at the mercy of federal allocations at this point.
Okay, Alex, let's keep moving.
Yeah, absolutely. Well, I mentioned in the intro the question about this having the second doses available, and that's a question on a lot of people's minds, especially as they get their first dose. Michelle Pierce is with us, I hope. Michelle, are you there? Oh, Michelle, she writes, I'm wondering, given the federal mandate to vaccinate more people in 1A and not have second doses, will those of us in healthcare being vaccinated now be able to get a second dose in the 1 month window. How is UMB handling this?
Marco? That sounds like a Marco question.
Okay. Well, I'll tag team it with Lieutenant Governor and Dr. Chen. So I'll start. So you're seeing a pivot from our federal colleagues moving to, they were allocating it per state and withholding the second dose. And now you're seeing this administration pivot to sending out a much larger amount and not withholding any potentially to the states, which means when it moves to states, then realize it goes from feds to states to locals. So you're going to see what looks to be a much larger allocation of vaccine soon. It doesn't happen overnight, recognize, but that will happen soon. The upcoming administration, I think, is supportive of. I'm not sure it's the entirety of the cash, but certainly a much more than holding back the second. Now, the concern that I think that I'm hearing on the question really fundamentally is, if we push out all the vaccine, will there be any left for me getting my second dose? So I think that right now, the logistics trail to allow that to happen, to assure that not only we broaden out the aperture for those who get first dose is occurring, and having more vaccine will allow that to happen, but also having more vaccine will also assure that those will get the second doses too. I have confidence. It's up to all of us to assure we're tracking that at the local and state level to assure those second doses are happening. But I'll turn to Dr. Chen on this one. But as I understand it, that you mentioned a 28-day window. There is some flexibility there that I wonder if Dr. Chen can speak to. The mandate around the 28 days has some flexibility for weeks to months to actually allow that immunity to occur and to get your booster in time. So it's not a 28-day, go or no go. There's some flexibility there, and I wonder if Dr. Chen can speak to some of that.
Yep, and that's absolutely right. So when we have these 2-dose regimens, and that they're different because one is separated by 21, the other one by 28 days, those are the so-called minimum amounts of time between the 2 doses. There's no maximum. And in fact, scientifically, we see it with a lot of vaccines that the further that you separate those 2 doses apart, that you actually gain a little bit more efficacy out of them. Now, it's not a lot. And sometimes it might be, if we studied it in a large amount, it might be just 2 or 5% or something. So really what you're seeing is a tension between trying to get those 2 doses in the quickest amount of time so that we get more of the population fully immunized. Now, because we're having this problem with kind of delivering these vaccines to the largest population possible, is that we're trying to make these vaccines readily available. We're not holding back those caches for ensuring the second doses at the federal level. So that's now being funneled down to the state level. And the state will then be allocating those to the local jurisdictions, the county level, the medical systems, and what have you. So again, that's why Dr. Marcozzi was really careful in saying that we have to track this very carefully to ensure that we have those second doses. But if it happens that you have that delayed second dose, it's actually not a bad thing, in that you still have a great immune response. The fear is that if you put them too close together, so 2 weeks apart instead of 4 weeks apart, that actually can harm the immune response in the end. So that would be the fear. Now, of course, we don't want to delay that second dose so long that you have more of an opportunity to get infected. So we don't want that to happen either. So that's why, again, we have to have a good response to be able to give those 2 doses to the entire population as best as possible.
Lieutenant Governor, anything to add in that from your view?
No, they're the experts. The only concern that we have on the state side is whether they're going to, push everything to us, to the state, to have to, hold vaccines that can't be distributed, and then the question, making sure that the production side, that those vaccines are going to come in for the second. If we get, a large amount and we start vaccinating more people, or able to vaccinate more people, just making sure that the production side is there to get that second vaccine.
Yeah, and the other thing, of course, it underscores is the importance of logistics and good electronic record keeping, so that we know who needs to get the second dose and when. And as I view this, I've learned in the COVID era that the world is about logistics. when
Yes,
it
it
comes
is.
to COVID. And this is one more example of that.
Right.
So, Alex?
All right. Well, Lorette Hankins has a question about all those people, and we have friends and family and people who don't work at UMB, don't have the benefit of having this very deliberate method to get in line for the vaccine. What do they do? Lorette, are you there?
Yes.
Go ahead.
Thanks very much for doing this. I keep hearing this from everyone I know, all the Marylanders that I've talked to, and we're all sort of saying, well, how do we know when it's our turn? We know if we're over 65, we know if we have a comorbid, but who is going to tap us on the shoulder or text us? Is it our PCP? Is it our county health department? I'm just shocked that everyone I talk to has the same question. So could you help us with that?
I'll start. I think if I'll give you one example. My 90-year-old mother, she was called by her healthcare provider. She goes to Kaiser, and she was called by Kaiser to schedule an appointment to come in and get her shot.
Wow.
And so we made arrangements. My nephew, her grandson, is going to take her to Kaiser on Friday to get her shot. So that's one example where the healthcare provider is calling patients and that meet certain criteria to get their vaccine. The county health departments will be calling some people, that are in those priority areas. Another anecdotal, I had to get an MRI for, just something. We get older, we need MRIs for certain things. And I asked the technician, I said, have you, gotten a call or registered for shots? And she said, yes, all of us here have, been signing up for getting our shots. And so that is through, I think the county health department is contacting the primary care doctors, the dentists, the local, healthcare officials. As time goes on and as we open it up more, like I said, the next group will be the 75 and above. It's going to be broadcast. We're going to have some public service announcements that the governor and I are going to be taping in the next couple of days. That'll be rolling out, and it'll talk about, your turn and when you are to go and where you would go. I think, and by the time we get to the full population, to healthy people, and I forgot the name of the young lady who just called, when we get to the healthy younger people, I think there'll be a lot of places where you can go, and hopefully even to the point where we have it at the private care or primary care physicians as well.
That's you, Lorette, the young, healthy people he's referring to.
Yes.
You describe a great example of how it should work. The Kaiser example is a great example that your grandmother or your mother got the call, but somebody was looking out for her. That's good preventive care, that's for sure.
Right.
So, Marco or Wilbur, anything to add?
My mother, who's an 82-year-old, also asked me as well the same question. So it's a very common question, and I think my answer was the state will tell us what to do when it's available, and it's not because they're not preparing. So again, I know that Governor Hogan may be given more details in the next few minutes, in fact, but it's something that is, again, we don't have it in place right now, so we can't announce it. We meaning, I am fully confident that our state is working on it, and that, again, it's not available, but when it is available, it will be announced.
Dr. Jarrell, I wonder if I could now that Dr. Chen just reminded me of something. So here's my when I get that question, because I get that same question, I say monitor 3 areas. Monitor the state's website on the guidance that's coming out, monitor your local health department, and then see what your physician is doing. Those are the 3 areas where you are potentially going to be vaccinated, because it depends upon what group you're in and where you're going to go and where there's availability for the vaccine. So those are 3 areas that I try to help, because it will evolve. Welcome to a pandemic. Things will we will change, and we need to be flexible and understand that. But those are the 3 areas that I recommend folks to continue to monitor.
That's a very, very good point. And yeah. I probably should have said that to my mother when she first was asking me a couple of weeks ago. And my sister. So yeah, they just call me.
Yes. We get the same stuff, I can assure you. Alex?
Well, there's obviously a lot of interest. One of our viewers mentioned that the Harford County Health Department sign-up form online for the vaccine was overwhelmed and crashed today. So people are out there, they're trying to find a way to do it. I want to read this anonymous question. This is from someone who says her husband works at a car dealership as a service manager. He has cancer. But when these businesses are expected to remain open because we need them, you know, every car can't break down and not be repaired, but they're not considered essential. They're not a healthcare worker. When are they going to get a vaccine? In what order are they in?
Well, they are considered essential. I mean, the business is considered essential, and that's where I think the definitions are getting skewed around. You know, when we were keeping businesses open during the pandemic, which we still are, it was essential businesses, and auto repair was considered an essential business. So if you are a technician in a repair facility, you are an essential worker. Now, so are the grocery store workers, the food distribution people, the food inspectors. They're all essential workers as well. The utility folks, the sanitation, police and fire, they're all essential. They're essential. It's just a question of the priorities, as we've been saying, that how we've worked with the Centers for Disease Control and Prevention, and that the state is following certain guidelines, and the fact that we only have a limited supply of vaccines. And so with the limited supply, it was to go to the most at risk, the most people who were dying, the workforce that treat us and keep us all healthy. And as we work down to the healthy but older person, the older person that has, you know, comorbidities, and we'll work our way down from there to the other essential employees who may not be an older person and they may not have a comorbidity, but they are an essential employee. So there's a pyramid, as Dr. Marcozzi said. If you go to the Department of Health website and go into the COVID section of that, you will see these the priority areas.
Great. Alex, we got time for one or two more.
Okay, I'm going to bring in James Cragen. James, ask your question. It's very basic, but I think everyone is thinking about this.
Yes, actually, I have two basic quick questions. First one is, can a person still transfer COVID once vaccinated? And the second is there a difference with the typical reactions between the Pfizer and the Moderna vaccines? So if somebody has a particular shellfish allergy or something like that, does that usually show up with the Moderna vaccine? Is it not with the Pfizer, or vice versa, or something else? And any other vaccines that are coming down the pipe?
Dr. Chen, that sounds like yours to start with.
Yeah, so the second one about the differences between the two vaccines and allergic reactions, we haven't found that yet. We haven't really distinguished whether one vaccine has more reactions, you know, with people who have shellfish allergy or penicillin allergy, for example, or anything like that, than another. So I really still consider these two vaccines very much comparable to each other. Now, the next vaccines that will be coming down the pike, you know, we're looking at something coming from Johnson & Johnson and something coming from AstraZeneca. Those are two different types of vaccines in the Moderna and the Pfizer vaccines. So again, you know, a person who has a severe allergic reaction to the Pfizer or Moderna can get those other vaccines that are coming down the pike. Hopefully I answered that question. Again, I don't think that we know enough that these two vaccines that we're using right now are different from each other and have a different allergic profile. The first question, remind me again, what was the first question?
Transmissibility post-vaccine.
Okay. So if you get the first dose and, you know, we expect that there might be some protection. We think that it might be short-term protection, so we don't know how long that will last. So it's still important to get the second dose. Now, the infectivity, the ability to transmit. So even if you get 2 doses, that data was 95% efficacy. That means that 1 in 20 did not get protected. So that still implies that even if you as an individual get fully vaccinated, you get your 2 doses, you still have a chance, a smaller chance, of course, to transmit. So I think that we still have to have a posture as a population, as we all look forward to everyone getting vaccinated around us, that even if we're vaccinated ourselves, we still have to perform the universal masking and the hygiene and the physical distancing and those sorts of measures until we get most of the population and open up. So that's really what I mean by that idea of opening up Maryland, is because even if only 50% of us get vaccinated, we might not be able to fully open up. We really have to get to that higher proportion of the population to be able to fully open up all of the sectors. So, so I think that that's what we have to remember.
Dr. Chen, isn't there a period of time also between when you get the vaccine to when you start getting the benefits of the protection, 5 to 10 days or something of that nature?
That's right. With any vaccine that we have, it usually takes some period of time between the time you get your vaccination and the actual onset of that protection. It needs, time for the immune response to work. And so I generally throw out, it's about 10 to 14 days. So just roughly say 2 weeks. Okay. It's an easy way to memorize, but generally that does stand. 2 weeks after vaccination is what you want to really remember before you expect the full amount of protection from a vaccination.
But that's not to say that people should stop wearing their masks or social distancing or hand washing. You would agree with that?
That's right. Yep. And, across the board in our medical system, we're vaccinating all of our doctors, nurses, respiratory technicians, everyone else under the roof of the medical system, and we're still enforcing strict PPE. So that's, again, what we want to do, because we understand that we still will have transmission events possible until we get the entire population of Maryland, because people outside of the hospital could still get an infection to a hospital worker. So again, we still have that posture. So that just gives you an idea of how critical it is for everybody to get vaccinated as much as possible.
Alex, we're right on the hour. If you've got one little tiny question for the Lieutenant Governor, that would be great.
Well, one last quick question. Julie Mosher. Julie, are you there?
Yeah, hi.
All right.
How long is the vaccine effective once somebody has their 2 doses? And how will we know when we need another round of vaccinations? Will it be months? Will it be years?
That's not for me.
Question. I wish, I don't know if the Lieutenant Governor feels comfortable enough to.
No, that's not.
So I'll venture a guess. So I think that, again, we're really hoping that these vaccines last at least a year. So we're not talking about having another dose next winter. We're hoping that we get out of this situation. We don't know if it'll protect for even longer, for 2 years or 5 years. We don't know how much this virus will persist. We think it probably will. It will probably return back, if we're fully successful with vaccinating over the summer, as just a common cold-like virus and not really be as important. I don't think that we'll have to see another round of mass vaccinations for the winter again coming up. But again, if we're going to have more vaccination rounds as a routine vaccination, maybe incorporated, just like our annual flu, it's possible. And we really don't have enough data yet to know what this virus is going to do, whether it mutates, and how long these vaccines last. So stay tuned.
So I'm in my 4th month, now entering my 5th month of the Moderna trial. I did get the vaccine. It's going to go for at least 2 years, is my understanding, in terms of serology, et cetera. So that's how we'll get part of the answer to this. And part of it will be epidemiological data to say, is there another surge going on? So that's where some of the answers will come from. This has been a wonderful event. First of all, Lieutenant Governor, I know that you are very busy and this is a little piece of your day, but we really appreciate it. And I know the audience got great pleasure out of hearing your thoughts. And I have to commend you. I think you know the rules relative to the different phases of the vaccine distribution certainly better than I do. So it's nice to know that level of detail at our state. So thank you for being here and participating. For Dr. Marcozzi and Dr. Chen, I know you start before before dawn and after dusk is not until when you finish. So thank you for an hour out of your very busy day. It's most appreciated. I'm sure we'll be back because the questions will continue. How many did we have left over, Alex?
Oh, I couldn't begin to tell you. A lot of them are about particular comorbidities and very narrow questions. Very important to the individual. So.
Well, we'll have more questions for you. So I look forward to the next time, Lieutenant Governor. Well, thank you for all you're doing for this state. It's most appreciated. So thank you.
Thank you. Thanks for having me.
See you all. Thank you.
Okay, take care. Thank you.